This is a podcast of the Nuffield Department of Medicine. Today, Professor Bridget Wills tells us about her research on dengue diagnosis and management. Hi Bridget, can you tell us a bit about where you actually work and what your research interests are?
I'm based in Ho Chi Minh City in Vietnam. I work at the Oxford University Clinical Research Unit. I've been there for a very long time, nearly 18 years now, and I'm a paediatrician by background training. So I focus on research related to a lot of different diseases that are common or pose a particular problem for children in Southeast Asia. Over the years, my major interest has honed down on dengue, which is a viral infection transmitted between people by mosquitoes. In the majority of people who get bitten by an infected mosquito, they can experience an unpleasant febrile illness that's a bit like flu, but in a very small proportion of cases, certainly less than 2 or 3%, there can be complications which can be very serious and occasionally result in death. So a lot of my work is trying to understand how or understand who is likely to be in that very small percentage who develop severe disease, and then also in that group to see if we can improve management. At the moment there aren't any specific therapies available, so management is primarily supportive, but there are a number of different options that we are considering.
Then what are the mechanisms underlying this sort of severe dengue?
Well, unfortunately, we don't know. We know a lot about the virus, and we know about its structure and how it interacts with the human immune system, how it's passed between mosquitoes and humans. We know a lot about the life cycle, but what we don't know, and what we'd really like to know, is how in that small proportion of people does the virus end up causing severe disease. The major problem that happens in people with severe disease, particularly in children, is that the blood vessels don't work very well and become leaky, so people can develop a type of shock, which can be very rapid and unfortunately in a small number of children leads to death. So what we're really trying to understand is how the virus interacts with blood vessels to make them dysfunctional, to make them leaky.
How does the management of dengue differ in children versus adults?
Well, children are obviously very similar to adults in many ways, but their physiology is different. They're in the developing phase of their all of their physiological systems. Children are much more likely to develop leaky blood vessels than adults are, and if they do, then they're much more likely to develop shock. So we are focused on trying to understand the interaction between the virus and the blood vessels, particularly in children, so that we can look at developing novel treatments to interfere with whatever is happening at that level.
What are the most important lines of research that have developed in this field over the last, say, 5 to 10 years?
Well, as a clinician, obviously, I think that the areas of research that are really important are the areas that focus on diagnosing and trying to improve management in people who suffer from dengue. But there's also a number of other areas that have become very important in the last 5-10 years. One is, of course, the development of a vaccine. There are a number of vaccines that are in process of development and at various different stages of research. But there's one which has recently gone through phase 3 trials and is in fact just been licensed in one country. Unfortunately, it's not as good as we would like, but it's still a step in the right direction. The other area of research that is of important public health interest is research to try and interrupt transmission between humans and mosquitoes, and there's a particular bacteria that mosquitoes can be, if you like, infected with, that can, well, there's a theory which there's now quite a lot of evidence to support the fact that if you infect wild mosquitoes with this bacteria, you can limit the capacity of the mosquito to transmit dengue onto another individual.
Why is this line of work important? Why should we fund it?
It's a huge problem worldwide. Very, very many people suffer from dengue. Admittedly, most of them don't get serious disease, but if you have millions of people who experience the infection, and even if a small proportion of them get serious disease, then I think trying to understand how that happens and trying to prevent it and treat it is a very important area of research. Not maybe locally here, but globally, very important.
How does your research fit into translational medicine within the department?
Well, I would say that all of the work that I'm involved with is basically translational. We're aiming to try and improve understanding how a disease process works, diagnosing an infection, and then improving the outcome of people who are suffering from that infection. In Vietnam, many of the doctors, well, all of the doctors that I know in the centre where I work, are actually very good at diagnosing and treating dengue, but they have a huge amount of experience because it's one of the countries which really has a massive problem. But as dengue has spread around the world, and there are now estimates of 50, 100 million symptomatic cases of dengue a year globally, as it's spread around the world, doctors and nurses who've not previously come into contact with this as a common and potentially serious infection, they're faced with managing patients, and often experience, well, as in many things, experience really counts. So what we're aiming to do in a collaboration with WHO is try and improve guidelines for diagnosis and management, particularly for staff who are being faced with managing this disease that they may not, or they may be unfamiliar with.
I see. Great. Thank you so much, Bridget. That was very interesting. Thank you.
Thank you.